Have you ever wondered how prevalent diabetes is in pregnancy? It's a topic that's gaining more attention these days, and rightly so. Diabetes during pregnancy, often referred to as gestational diabetes, is a condition that affects between 4 to 10% of all pregnancies. It typically develops around the 24th week of pregnancy, although it can occur earlier. But there's another category too: pre-existing diabetes. This includes women who have either type 1 or type 2 diabetes before becoming pregnant. The exact numbers are a bit harder to pin down, but it's a significant portion of the population. Why is all this important? Because diabetes in pregnancy can lead to complications for both the mother and the baby. It's a condition that requires careful management and understanding. The more we know, the better we can care for those affected. Understanding diabetes in pregnancy can help healthcare providers offer better care for their patients. Let's delve into the first type of diabetes in pregnancy: gestational diabetes mellitus. This is a condition that typically develops around the 24th week of pregnancy and can affect between 4 to 10% of all pregnancies. The exact cause of gestational diabetes mellitus is not entirely known. However, it's believed that hormonal changes during pregnancy can lead to what is called insulin resistance. This is a condition where the body's cells don't respond as effectively to insulin, the hormone that regulates blood sugar levels. There are certain risk factors that can increase a woman's likelihood of developing gestational diabetes mellitus. These include being overweight, having a family history of diabetes, or being older than 25. It's important to note that while these factors can increase the risk, they do not guarantee that a woman will develop the condition. So, how is gestational diabetes mellitus diagnosed? Well, it's usually identified through an oral glucose tolerance test, often referred to as an OGTT. This test is typically performed between the 24th and 28th weeks of pregnancy. However, some women may be screened earlier if they have risk factors that make them more susceptible to the condition. In a nutshell, gestational diabetes mellitus is a common condition that can have significant implications for both mother and child if not managed properly. It's essential to understand the risk factors and to be aware of the steps that can be taken for early detection and management. This knowledge can go a long way in ensuring a healthy pregnancy and a healthy baby. Remember, each pregnancy is unique, and so is each case of gestational diabetes mellitus. Therefore, it's crucial for pregnant women to work closely with their healthcare providers to manage this condition effectively. The management plan should be individualized, taking into account the unique needs and circumstances of the woman and her baby. GDM is a common condition that can have significant implications for both mother and child if not managed properly. So, let's ensure we all play our part in raising awareness and promoting early detection and management. Now moving on to pre-existing diabetes in pregnancy. This term is used to describe women who already have either type 1 or type 2 diabetes before becoming pregnant. Unlike gestational diabetes, which develops during pregnancy, pre-existing diabetes is a condition that the mother has been managing prior to conception. During pregnancy, the demands on the body change, which can affect how the body manages blood sugar. This means that even if a woman has her diabetes well controlled before pregnancy, she may need to make adjustments during pregnancy to keep her blood sugar levels in the target range. Managing pre-existing diabetes during pregnancy often involves a combination of dietary changes, exercise, regular blood glucose monitoring, and possibly medication adjustments. It's a delicate balancing act that requires close collaboration with healthcare providers. Remember, the goal is to maintain optimal blood glucose control to minimize risks to both mother and baby. Pre-existing diabetes requires careful management during pregnancy to ensure the health of both mother and baby. So, what are the potential complications of diabetes in pregnancy? Let's delve into this critical subject. Diabetes in pregnancy, whether gestational or pre-existing, can lead to several complications for both mother and baby. For the mother, there's an increased risk of high blood pressure and preeclampsia, a condition characterized by high blood pressure and potential damage to organs such as the liver and kidneys. Also, a higher chance of cesarean delivery is often associated with diabetes in pregnancy due to the potential for large babies or other complications. Speaking of large babies, this brings us to fetal complications. Macrosomia, or having a large birth weight, is more common in babies born to mothers with diabetes. This can lead to birth injuries during delivery. Newborns may also face an increased risk of respiratory distress syndrome, a condition that makes breathing difficult. Additionally, babies may experience neonatal hypoglycemia, which is low blood sugar right after birth. In some severe cases, there's even an increased risk of stillbirth. Moreover, for the mother, there's an increased risk of developing type 2 diabetes later in life. This underlines the need for continued monitoring and care even after the pregnancy. As you can see, diabetes in pregnancy can lead to various complications, emphasizing the importance of proper management. These risks underscore the need to maintain a healthy lifestyle and work closely with healthcare providers throughout the pregnancy journey. How can diabetes in pregnancy be managed to ensure the health of both mother and baby? Managing diabetes during pregnancy involves a combination of diet, exercise, medication, and regular checkups. A balanced diet is crucial, with a focus on monitoring carbohydrate intake. Regular physical activity can also help manage blood sugar levels. However, it's essential to consult a healthcare provider before starting any new exercise regimen. For some women, diet and exercise may not be enough. In these cases, insulin or oral medications may be needed to control blood sugar levels. The type and dosage of medication will depend on the individual's specific needs and should be discussed with a healthcare provider. Regular monitoring of blood glucose levels is another critical aspect of management. This usually involves checking blood sugar levels multiple times a day to ensure they stay within a healthy range. Frequent medical checkups are a must. These appointments allow healthcare providers to monitor the well-being of both mother and baby, adjust treatment plans as necessary, and plan for the delivery. Depending on the circumstances, women with diabetes may need induced labor or a cesarean delivery. Lastly, the management of diabetes does not end with delivery. Monitoring should continue postpartum to ensure blood sugar levels return to normal. Managing diabetes in pregnancy is a multifaceted approach tailored to the individual's needs. This approach, combined with the support of healthcare providers, can help ensure a healthy pregnancy outcome for both mother and baby. In conclusion, diabetes in pregnancy is a significant health issue. We've delved into the two main types, gestational and pre-existing diabetes. Their causes may vary, but the risk factors and complications are real and significant. The importance of management strategies, including diet, exercise, medication, and regular checkups, cannot be overstated. By understanding and managing diabetes in pregnancy, healthcare providers can help ensure the best possible outcomes for both mothers and their babies.